very fortunate today to be joined by Professor Jo Thompson-Kuhn. So Jo is going to be talking through some of her experiences in creating, creative research outputs. And Jo has worked at Exeter since 2009 with the evidence synthesis team, which she leads, has a huge amount of experience in this area. And as I've said in workshop 1, these workshops are around sharing our experiences of different approaches to communicating research creatively. It's not a definitive how-to guide because there are so many different ways of doing this. And you will find your own path depending on the research you're doing, the budgets you have, the teams you're working with. But hopefully it is a useful insight to hear about some of our experiences and to work through some exercises to help sort of broaden those horizons a bit. So I'm going to move on to slide 2. Which is just to say how this workshop's going to be structured. We've got an hour and a half. It starts at 2 o'clock, so we finish by 3:30. Well, I'll just give you a very brief introduction to the workshop and to Jo. We'll talk through the agenda and how this will be structured, and then we'll have a forward look to the next and final workshop, which should be quite exciting. So that final workshop, workshop 3, is on the 22nd of May, and it's with Dan Porter, who is one of the co-founders of Scriberia, which is a visual thinking agency I've worked with a lot, Jo's worked with, and they've done an awful lot of research and collaboration in this area. So that's going to be really exciting. So the agenda for today is to talk about creative approaches in research, and part of that will be sort of Jo's experiences in this space. We'll have a little exercise and come back and talk about that. Then Jo's going to talk a bit more about strategic decision making and using creative approaches appropriately. Then we'll have another exercise. Then we're going to have a 10-minute break. That will be around 2:50. And then we're going to come back and talk about building networks, long-term impact, and then we will wrap up and have a quick space for feedback and any questions about the next workshop. So without any more chatting from me, I will hand over to Jo.
Hello, hi everybody. So I'm going to talk just, may not be for as long as 15 minutes, a little bit about, as Harriet said, my experience with using creative approaches in research. So I'm going to talk a little bit about my background, why creative approaches, and some of the things that we've learnt. Okay, so I'm a systematic reviewer. I have been actually working in Exeter since 2000, so a little bit longer than Harriet said, and I've been doing systematic reviews for all of that time. I currently lead several NIHR-funded evidence synthesis programs, and also have had some funding to do sort of individual projects, but it's all evidence synthesis and it's all really different topics. So I guess creative approaches, I've been thinking about that maybe since about 2015, 2015, and I've listed there some of the things that we've done, short briefing papers, blogs, podcasts, animations, illustrations. You heard about the board game that Noreen made in the last workshop, and also really simple things like Twitter cards. And some of the ways that we shared things. So it isn't just about making something creative, you've also got to find then a way to actually share it. So still calling it Twitter, but it's X. So different ways that we've shared things, Twitter, using just paper, via email, newsletters, face-to-face meetings, virtual meetings, and we don't have our own Facebook and Instagram, but we have used those, other people's. So lots of different experience, and I guess it's been thinking about what works best for which project at each time. So next slide. Okay, so why do we do creative approaches in research. And I guess in some respects it's because funders expect it. So whilst we might have written in a funding application, 10 years ago, we will publish 3 papers in peer-reviewed journals and present at academic conferences, and the funding panel would be completely happy with that. Now we might write something. So this is from a bid for a project we did on intergenerational interventions, so systematic review. And so this is what we were kind of saying at the application stage. So as well as publications within the Campbell Library, we're going to share the findings using a variety of formats like blog posts, briefing papers, podcasts, and we're going to target those to specific audiences. And we're also going to work with our steering group and our advisory group to make sure that our findings get to the people who can benefit from them, as well as those who design and plan and deliver services. So there's been, lots of interest in the way that we communicate research and the importance of impact, getting the research to people that can use it. And so my core role is within PENARC, which I expect most of you have heard of, the collaboration between the NHS and academia in the Southwest. And our kind of mission statement is to improve the lives and quality of health and care in the Southwest through applied research. And to do that, we need to be able to get relevant and useful research to the people who can use it. So I suppose that's also a really big driver. So the funder, but also what is it we're actually doing here? We're trying to improve health and care. And so we need to be able to get the research to the people who can use it. Okay, I think it's the next slide. It's hard that I can't control the slides. So another reason why I got into creative approaches for research is I was inspired by Sarah Chapman, who was the knowledge broker at Cochrane UK. Sadly, Cochrane UK funding ran out in March this year, so it's no longer a thing. But Sarah was just really inspirational. If anyone has ever read or even just seen the front of a Cochrane review, you'll know that they're very tedious. And Sarah just did an amazing job of making all of that evidence really accessible and interesting. And so there's some links. I'm guessing you'll get the slides. So the Evidently Cochrane blog has been archived. It's still all there, but it's some really fabulous examples in there of how to make the research, which is really important. Cochrane reviews are like the gold standard of evidence synthesis. How to make it really interesting and useful for the people who can use it. And there was one review in particular that I just thought, oh gosh, this is there's really so much more we could be doing apart from just publishing our papers. So Cochrane published a review on portion size. I think it was in 2015. And basically, it was a very interesting review, likely to get picked up by the media, because it basically, the result of it was if you put more food in front of people, they will eat more. So that's a really simple message, a really easy message, and something that Public Health England, as it was at the time, were really interested in. But the way that they went about sharing the research, so they did their Cochrane review, but they also had a blog post which contains a video and an animation and infographic. So that was making it again much more easy to access and understand. So that is a useful way of sort of drawing people in. But they also wrote a policy relevant paper in the BMJ, which has okay, so you're the policymaker, this is what you need to do, this is what you need to know. And that also includes a podcast and an infographic. And they had a website story that reflected on all of their media attention, and the media coverage. And then they wrote a methods paper describing their approach to communication. So how did they go about this? It talks you through how they wrote a communication plan, how they worked out what their key messages were, and then how they thought, oh, this is going to be the best way to share those messages. So it's a really neat example, and it kind of shows that we're trying to have the Cochrane review, is that's the kind of the research and the results. Then the blog post is trying to get to people who maybe don't have time to read that whole thing, and I'm not sure who anyone would ever have time to read the whole thing. Blog post has got like the key findings and an easy way to read it. The policy relevant paper is there to get to the policymakers. The website story, potentially that's for researchers as well, to get sort of their interest in how we can communicate better. The methods paper then that's really for the researcher audience. This is how we went around our communication. This is how you could do it. And then thinking about different methods as well. So the podcast, just because different people have different preferences for the ways that they access information, and also different people on different days have different preferences. So that, I felt like that was a really good example, and like really we could be doing more than just publishing our reviews. Next slide, I think. Yes, so some of the things that Sarah got us really to think about were like, what is it you're trying to do when you do creative approaches in research, or when you're trying to communicate your results? And I think it comes down to these three key questions, and these are the questions that sort of underline all of the creative dissemination that we do. So what are the key messages? Who needs to know about them? And how can we get the messages to the people who can use them? And it is that simple. It's like, what are you trying to say? Who are you trying to say it to? And how are you going to say it? Okay, next one. Okay, I think we missed one somewhere along the line, Harriet, but no worries. So this is some of the things that we've learned along the way, and I'm going to talk about, I think there are 7 different things that we've learned, and then I've got an example that explains that covers some of those. So being really clear about what your aim and purpose is. So your aim and purpose of your creative approach should be to present the key messages in a useful and accessible way. So none of this is rocket science. It's really simple, but sometimes we forget what it is we're actually trying to do, because the creative approach is probably much more exciting than writing a scientific paper. But the main aim and purpose of it is to try and get those key messages out in a useful and accessible way. Using a multi-layered approach, this is something that Sarah Chapman really advocated for. So it's really easy to think that we just got to think of the one way that we're going to. Is it going to be a blog post, or is it going to be a podcast, or is it going to be we're going to tweet about it, or whatever? But actually, because as I said just now, different people have different preferences on different days. And also, whilst when you're talking to sort of marketing, communication people, they might say, so who's your audience? That's what you've got to do. You've got to imagine your audience. But we're going to have lots of different audiences. And on any day, you could be a mother, a daughter, a carer, I don't know, a nurse. And in those different settings, you're going to have different requirements. So you might just want to know the answer really quickly, or you might want to read it in a lot of detail. And you might be really interested in a podcast, or you might be really interested in you might be much more attracted to visuals. It's very difficult to kind of pigeonhole and say, okay, so nurses, we think they're going to want, I don't know, they're going to want podcasts because they're not all the same. So thinking about a multi-layered approach, maybe something quite simple in a tweet that maybe leads somebody onto a blog, that maybe leads them onto a podcast, that maybe leads them on to the full paper. And then maybe after that, there's a policy paper. So yeah, lots of different ways is probably the answer. thinking about digital versus non-digital. So I certainly spend most of my time looking at a computer. If I'm not looking at a computer, I'm looking at my phone. And so it's easy to forget that not everybody is on a device all day, every day. And sometimes your most appropriate method to share your creative approach might be on paper. And I'm not sure if Noreen mentioned this in the last last session, but for the Robo Pets and Pet Therapy project, we created a briefing paper, and normally we would just email that to people, or we'd put a link to it on Twitter. And actually, we realised that from talking to them, that people who care home staff, they don't sit on their phone all the time. They're not looking at it. So they needed it in paper. They needed to put it on the notice board. I think for other projects, we've had posters. It's just talking to the audience to find out where do they normally access their information. There was a project that we did with children and young people, and we asked them, did they go on Twitter? And they were like, no way. Of course we don't. Twitter's for old people. So, maybe depending on your topic, it may be that you need to venture into Instagram or TikTok or something like that. So role of non-researchers. So they're really, really important to help you to distill the key messages and help you to work out where you're going to share your product. So as researchers, we usually get really tied up on the methods. We want everybody to know that we did a fabulous job, that we used really exciting methods, that, we're really clever. And actually, the people who are going to use the research, they don't care about that. They would like to know that it's been done well, but they don't want to know all the ins and outs of how you did it. They're not really interested in how clever you are. They just want to know what the message is and how they can use it. And so talking to non-researchers and getting them to help to see what are the key messages is really important. Choice of images. This is another Sarah Chapman thing, and there's I haven't got the link to it, but there is a whole lot of stuff on the Cochrane site about using images, and I realised there's a mistake there. I should say the wrong image will draw attention away from the message. So if you use the wrong image, there was a big campaign on Twitter not so long ago, which was hashtag no more wrinkly hands. I think it still is the case that often if there's a news story, now my slides are gone all together. If there's a news story about old people, often the picture that they use is of an old wrinkly hand, and actually not all old people have wrinkly hands. I think there was something on Twitter just the other day about was some advert for a writing competition or something for over 50s, and they used wrinkly hands for that. I think over 50s, that's quite young to be considering that we'd all have wrinkly hands. So the next point is evaluation. We have tended to do very informal kind of iterative evaluation. Some people like to do something more formal. I guess it depends what your purpose is, but you do at some level want to know whether what you're doing is working. So it's something to think about. A lot of people will collect like statistics on, how many people downloaded it, or how many clicks on Instagram or something, and that's useful. But you don't know what happened as a result of that. So sometimes talking to the people who you're hoping will be looking at your output is more useful than the numbers. And then the last one is unexpected benefits. So sometimes just by having the conversations with your potential audiences, you're helping them to, it is like two-way conversation. So the researchers will be learning, but also maybe the healthcare professionals will be learning. Maybe we've found sometimes in our projects that healthcare professionals then understand much more about what is a systematic review, because they've been part of the whole process and they've been part of working out what the key messages are, and they understand more about the limitations of a review, the limitations of the research. And that's those two-way conversations really helpful, and also in improving clarity around what the key messages are. So I think that one is done. So I'm just going to give an example which hopefully talks to some of those things about how we go about creative communication. And I have given the links there so you can see them later, and I'll talk a little bit more about some of the products. So this is a review about caring about care, improving the experience of care for people with dementia in hospital. It was 3 systematic reviews, and we were interested in, so Ileana knows lots about this one, so hopefully she's not going to catch me out when I get it wrong. So we were interested in things that have been tried to try and improve the experience of acute hospital care for people who are living with dementia, whether they work, whether they're value for money, and what people's experiences was of them. And we included prior and current carers, healthcare providers, commissioners, and researchers. And as a result of the project, we developed 12 pointers for service change, which are key institutional and environmental practices and processes that could help improve the experience of care for people with dementia in hospital. We took like a multi-layered approach. So we started off by writing a briefing paper, and the briefing paper is really helpful in getting a very brief summary of the whole project. So you can imagine 3 systematic reviews. I think the whole report was about 50,000 words, many, 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 many pages. But if you want to then communicate with an artist, you're not going to ask them to read it. And so distilling everything down into a briefing paper, and we use a format of 1+3 pages. So the first page, I'm going to come on to that in another slide. So briefing paper. Then we also wrote some blog posts, and then we worked with an artist to create a visual representation of the pointers for service change as an A5 booklet. And the intention was that that would be distributed in paper format to hospitals. We also had some of our researchers and carers speaking on BBC Spotlight, and then we had the peer-reviewed publications, conference presentations, and a summary paper on the pointers for service change, which informed the British Geriatric Society position statement. So lots of different outputs, as well as the massive report. And the next slide should be about the briefing paper, I think. Yeah, so the briefing paper is on the first page. We have basically a summary of what we did and what we found. So the next click should be like no. Yeah. So what we were trying to do, and a link to the full report, and then we reserve, so the middle 2 pages are kind of the meat of what we found, and then the back page, which is shown in that last picture, is the bit that actually researchers want to talk about most. So we mostly want to talk about how we did it and what we did. So we put that on the back because likely the people who are going to be wanting to use the evidence, they're not really interested in how many studies we had or where they were from. And so the next slide is about the blog post. So this is our blog, Evidence Synthesis Team blog, and we wrote a post which was trying to reach out to people who might be interested in the findings of our results. And we were asking them, what do you think? So we know that this is what we found in the research. What do you think? And we were hoping from that we would get some input into the pointers for service change. We set up a Caring About Care forum to try and continue the conversation. So that was trying to be a little bit more interactive with the audience. And then the final one, I think, is the booklet. So this is where we worked with an artist, and he created this image of a hospital with the 12 pointers for service change, one in each room, and then each page of the booklet has a different letter. So this one was A for Ask Family, and this is the cartoon draws from the research and is explaining this at this point of a service change. So when we first created this, we gave the artist a briefing summary. He talked to us a lot about the project, and he went away to design it and to think about how we could present the 12 pointers for service change in a booklet. And the first draft that came back, when we showed it to our clinical partners, they were like, oh, no, you can't do that. That's not what a hospital bed looks like. Because the artist had drawn what he thought an artist. He's not, he's an artist, so he didn't work in hospitals, hadn't been in hospital for a while, didn't know what hospital beds looked like. And they've said, oh, no, you can't have a chair like that. There's no way we'd put an old woman in a chair like that, because she would never be able to get out of the chair. So we had to then go back to the artist and ask them if they could redraw lots of the bits, which was a little bit challenging, but really shows the importance of working with the audience, because it wasn't until we'd corrected those things in the images that we could really get the clinical partners to engage with the text and what we were trying to say. Is there another slide? Yes. So hopefully that example shows some of the things, these points that I was making earlier, that I think the multi-layered approach, digital versus non-digital, we really wanted this to be a non-digital booklet that was in staff rooms, but unfortunately it was ready to distribute in early 2020, at which point with the pandemic there was no paper in hospitals, and so we weren't able to distribute it in that way, and it has been distributed digitally, but I'm not sure whether it is successful as a booklet like that, a digital booklet, as it would have been if we could have done it on paper. The role of non-researchers, really key. Choice of images, that's again really key. We really needed our clinical experts to help us with that, because we could check it and we're not really experts on what hospital beds look like either, so we would have missed it. Evaluation was a bit tricky because of COVID, so we're not sure how much this has been used, but because we were able to do the summary paper and publish that also includes this. So we have found another way to share it through a peer-reviewed paper. I think maybe that's the last one, is it? Yes.
Yes, it is.
Hopefully that is helpful, and I'm happy to answer any questions on anything, because I feel like I've gone through it quite speedily.
Thank you, Jo. Thank you very much. If you have got questions, do pop up in the chat. Oh, yes, we've got some questions already. So one question was around the reach of the blog post. Do you know how far you reached, how many people you reached with that?
Yes, but I can't tell you. We can see that on the I think we use WordPress, and you can see who's clicking it and where they are. We don't tend to get any comments on that. I think the tricky thing about all of this, I think, is we relied very much on Twitter previously, and now we don't have Twitter, and I don't know that we have a good alternative. So I'm on Blue Sky, and I haven't really found our people on Blue Sky, and I post there and nothing happens. I'm on Threads, but Threads is linked with Instagram, so it's all my personal contacts, so I don't really use Threads for work. I don't really look at threads. So, and the uptake on Twitter has really, really dropped off for us. So, I think it is a bit of a challenge. Yeah,
Um,
blog posts work. Our best, most successful blog posts come when you're able to tag in people that you've that have had some connection with what you're talking about before, and on Twitter, but you're relying on them still being on Twitter. So yeah.
yeah. Um, and the other question we've had is, how do you source your artist? And can you give a ballpark figure on costs? Can you remember how much that cost?
I can't remember how much that costs. Well, there's several that we work with. This particular artist who did this one was a friend of a friend. I think we've got another example later who's somebody from Exeter. And it's less than £1,000, I think, but it's probably in the region of 600 or 700, I'd say. But I
And
guess
that
it's
was 2020.
yeah,
So that
yeah,
will have changed, but
yeah.
yeah.
And I think it depends on what you're asking. Yeah,
Yeah, and equally, we've got really helpful comments. The uni has got a preferred list of suppliers. So again, Exeter has that. Your own institute, if you're watching this on the recording, will have a list of preferred suppliers that people will have pre-registered for. So it's worth asking your research teams for that. And then CAMP is a regional network of professional artists, which is worth knowing about, and we'll make sure that all these links and comments are incorporated into the workbook that I'm producing for the end of these workshops. So you will have access to all these resources at the end. So in terms of timing, Jo, I'm sorry to make you keep talking, but I think we're going to forego the first exercise, which was really to reflect on your own research and the different sort of routes that you might have to creating more creative outputs. I think we'll move straight on to strategic decision making, if that's okay, Jo.
you mean I talked for too long?
No, you were just very interesting. So I'm gonna share screen again for strategic decision making, and we will crack on, if that's okay, Jo.
Yeah,
Can you see
I
that?
don't recognise this slide, do.
Okay, that's fine.
Let's go to the next one.
Yeah, let's do that. Do you recognise that slide?
Yeah.
Excellent.
Yeah, okay. I think so. I wonder if they've gone in the wrong order, but it's fine. So yeah, I'm going to be kind of repeating myself a bit, I suppose, because we haven't had chance for a break for you to forget what I said. Yes. So I guess we're thinking strategically now. Why do you want to use creative approaches? So again, it's about considering the aim and purpose, speaking to your potential audiences, thinking about what the key messages are, who are you trying to reach, do you have the interests and skills in the team, and what time and resource is it going to take? So I think some of these are challenging, and I think the next slides are going to talk about the challenges. So yeah, a clear plan, as with everything, is really, really helpful, and starting early. So one of the challenges is that when you're writing your bid, often you'll need to say in it what you're going to do around dissemination. And that's a challenge because you don't yet know what you're going to find. So you could say, oh, we're going to make this video and we're going to do this and this and this. And then if your results don't really fit with that, then that is, it's not going to be successful. So, but starting to think as you're sort of getting your early results, starting to think, okay, how are we going to communicate these? Talking to your partners, clinical patient partners, starting to think about how we're going to present it and what we think the messages are. And starting simple and building up. So starting off by just being able to distill into plain language what it is that you found or what it is you want to share, and then build that up. Sometimes having the plain language summary is a really good something that's really easy to share with other people. So it might be sharing with an artist or a podcast person, or sharing with other people in the team, sharing with just other people as a way of saying, no, is this interesting? Who should we share it with? How should we share it? Working with your potential audiences, building lots of opportunities to share and check understanding. Think about how you're going to share it as well as what you're going to share. And also think about key events. So it could be that there's some key event coming up that's really relevant to your topic, and thinking about how you can tie in with that. So for one of our projects on intergenerational activities, there's a global intergenerational week. So we knew that we wanted to have something we could share at that time. So that gives you like a milestone. And it's good to start thinking about when those might be early so that it's not a big surprise when you get to it. Okay, next one. Again, with your key messages, I think I've said some of these things already. Starting early, having your plain language summary is a useful tool. Considering all the potential audiences and what do they want to know. So it may be that it's really clear that who you want to communicate your main message, but there might be some messages for researchers, there might be some messages for policymakers, for parents or other people. So think about all the different audiences and what they might want to know. And be prepared to deprioritize things that you feel important but no one else seems to be interested in. So that's like referring to what I was saying about the methods. So you may be really interested in the methods, and for some audiences that might be that might be the message. But if you're trying to communicate something you want to share with people and they're going to do something with it, they may not be interested at all in the methods. Next one. So it's often difficult to know what you're going to end up with, but you can maybe include a ballpark figure in the bid. So you might not want to set out to say you're definitely going to do a video with 6 minutes long and whatever, but you could include an amount of money, say £1,500 or something, which you think would cover various different options that you could do. Timing can be really challenging at the end of a project because often when we have projects where people are on fixed term contracts and the dissemination happens towards the end, and if something happens and everything gets shuffled along, it can be difficult to get have time to do the creative bit properly. So again, start thinking about it early. Some of the things we're talking about can be quite time consuming, so it's important to, really talk about it within the team. Is everybody keen on this? Is everybody going to help? Or is it something that isn't going to get a lot of take up? And be realistic about what is possible. So we have a podcast channel. We don't have many podcasts on it because actually we realised that most of the team aren't that keen on doing podcasts. So it sounded really good, and it does sound good. But unless people it's time consuming to talk without to find the right people to talk and to record it properly. And if everybody doesn't have that passion, then it doesn't always work. Next one. Yeah, so the plan might change. You might be really, really keen to make a podcast, like I just said. But if your audience doesn't think that will be helpful, or things like the pandemic or political situation might change, so the findings, the results are not so interesting or may become very interesting. So you do need a bit of flexibility, but the multi-layered approach hopefully helps to mitigate some of these challenges. And then this is something which bothers me a bit, longevity. So will you be able to use the output after the paper's been published? So often we get to the end of the project, it's really exciting, and then we submit the paper for publication. Again, really exciting, then it gets published, and then we can have planned to be sharing different things at that time. But then what happens? So will you be able to use the product or the output afterwards? And how will you ensure that it's still accessible? So sometimes we have a project web page, but sometimes they don't get maintained. Will you be able to reuse any of the elements, and where will you store it? So those are just things to think about to be sure that all the work that you've done in producing the creative output is not lost. So the next one. Yeah, so I'm just going to give an example of that. So this is a lovely drawing that was done by Grace Elizabeth for a project that we did. And I think this figure appears in a journal publication. And it's got lots of, it's all about the infodemic during COVID, where there were just so many systematic reviews published on similar topics. And a lot of them weren't very good. And so we distilled out some messages for various different audiences about what we need to be doing. And I think it was all for the time, and it was all very exciting at the time, but I think we felt like we could do a bit more with it. So David Walker, who's the Penark creative person, media person, he was able to make it into an animation for us, and we've actually used it on Twitter as the animation, and also we've used it in sort of the introduction to several workshops. So just giving it a little bit more life, and I think Harriet might be able to play the animation just to give you an example of how that works. He did it on some app on his phone. I think it was a free app.
Actually, Jo, I think time-wise, we will share the link so that people can have a look in the break if they want to, or further on. And then
Absolutely
we'll move on, if that's okay.
Yeah.
That's fab. Thank you. It is a super animation. It's very worthwhile having a look. So we have a couple of minutes now for exercise 2, which we will move on to. Yeah, there we go. We'll do it in the chat rather than having breakout groups, just to give people a little bit of a break. And if we can just take a couple of minutes to think about different approaches that you might have used already in your research, or that you would like to use. And when I say different approaches, it could be all sorts of different ways of communicating research in more creative ways. So it could be, blogs, podcasts, anything that Jo's talked about before, or that we covered in workshop 1, or other ideas that you've got. And then we'll just reflect on that, and then we'll have our break in about 5 minutes. Okay? We'll just take a couple of minutes to do that. This is fantastic. Thank you very much, everyone. Keep adding in. There's some really, really cool ideas. Posters with key messages, podcasts, blogs, um, ideas for dissemination while getting sort of feedback from practitioners as well. Ideas about how to communicate sort of really, really dense, complex information in a compelling way. So how to, for example, hand draw summary figures to really draw people in on that sort of complexity. Really lovely ideas. So thank you all so much for adding in there. Do carry on as you want to. We're now going to have a 10-minute break. So it's 2:54. We'll come back at 4 minutes, probably 5 minutes past 3, and do whatever you want to do. Go and have